What's up, everybody? This is Dr. Bartu with another episode of Pilltalkpodcast, giving you a daily dose of medicine to inspire, motivate, and live at your full potential. I have a guest on today, Dr. Joy Nwoke, who is a PGY1 resident at Baptist Hospitals in Southeast Texas. How are you doing today?
I'm doing well. Happy to be here. How are you?
I'm great. Happy that you can make it on. I know as a resident, you have a busy schedule. You're doing a lot, educating yourself, impacting the community, and training all at one time. So I appreciate you taking the time out to be on today.
Yeah, absolutely. No problem.
All right. So let's jump into it. What gave you your spark to want to become a pharmacist?
Yeah, so my spark to want to become a pharmacist, it's really weird because I can't really trace back why. A part of me thinks it may have been a career fair that I had experienced in elementary school, or maybe a billboard that I had saw, or maybe the fact that I would go to the pharmacy when I was younger. But being Nigerian, being in the medical field is very encouraged and emphasized. But I knew I didn't want to be a nurse and I did not want to be a physician. I liked chemistry. And so I love people. So tying those two things together, I think that's how I eventually ended up in pharmacy. But I've known since I was a kid that I wanted to be a pharmacist, in addition to some other things. But pharmacy was definitely something that I pursued very heavily. And I'm happy that I'm here now.
Hey, great. Happy that you could join the profession with us and be one of the people that's out here doing the major things with the pharmacy field. And, in pharmacy, there aren't too many, where I'm from in the South, Black faces in pharmacy. So it's good to see other showing representation in the field. So,
absolutely.
All right. So you started your pharmacy career, finished pharmacy school, decided to go and get a residency. Can you talk a little bit about the residency program?
Yeah, absolutely. So residency is an opportunity to get additional training in pharmacy. And for me, coming from a background working at CVS for 5 years, I started there when I was an undergrad and continued all throughout pharmacy school. I knew that I didn't want to be in the community setting. I didn't have a desire for industry or doing a fellowship. So having clinical experience through my IPPs and APPs really drove me to want to pursue a residency. However, a lot of people, everyone I believe knows how competitive a residency can be. And so I think I came into the process a little naive because I considered myself to be a qualified candidate. I did research. I had experience working in a pharmacy, not necessarily a hospital pharmacy, but a pharmacy. I did this thing called the Advanced Clinical Tract that my school offers, where it's like a mini residency. You have to interview and match with the hospital site, and you do the majority of your rotations there. I had great recommendations from my recommenders because I have personal relationships with them as well. And so I thought I checked off the boxes. My grades were good. I mean, I wasn't broke high, but they were still good. So came into it with that mindset, and I applied to like 6 programs, all in the state of Maryland, which is something that's not recommended, that you limit yourself geographically. And typically a lot of people apply to like 10 to 20 programs. But I was like, I'm going to do things different. Ended up not getting any interviews during phase 1, which was really shocking to me. But when you don't get any interviews, or if you're not interested in like ranking a program that you interview with, then you have to withdraw from the match. And then you can either go to phase 2 or pursue other opportunities. And for me, knowing that I didn't want to do community or industry or anything apart from clinical hospital, I went for phase 2. And I had, I think, 3 interviews. and I matched with my first choice, which is really happy, which made me really happy. And I absolutely love it here. Beaumont is a very small town, but for me, the people that I work with make my experience all the better, because it's residency is hard. It's very hard, and it's very hard to grow clinically in an environment where you don't feel comfortable or you don't feel like you can be wrong and still be viewed as knowledgeable or intelligent or smart in their eyes. And so I'm grateful that I work with my RPD and preceptors, and if I do something wrong, they don't try to be condescending, but they're very friendly and continue to push me to grow into the clinician that they know that I can be. And also has opened up the opportunity for me to do other things that I'm passionate about, which is community service for one. And so because I'm the only resident at the program, I'm able to go to Nicaragua in June for a medical mission trip where I'll be serving as the pharmacist on the trip. And so I'm really excited for that. So love the program, grateful for my process, and I'm happy to be here.
Nice. So you talked about getting into residency and how on your first round, you were unable to obtain an interview. So what did you have to do to get into the program on the second round, if you don't mind speaking about that?
Yeah, absolutely. So the second round is just like the first round, but in such a short amount of time. So what happens is on match day, the programs that are still available that haven't matched for all their residents become known, I think, at like noon that day. And you're basically scrambling to go through the programs, visit their websites, see if they're a good fit for you, because you still want to be able to assess that if you're going to be at a program for 1 to 2 years. So you have to research the program and also reach out to the program and have that kind of introduction. Hi, this is my name. I see that you offer these rotations. I've done this. I think you'd be a good fit. From there on Tuesday, that's when Forecast opens back up to officially send in your application to those programs. And from there, you'll get an interview. And then match day, I think it's like 2 weeks after. So then there's that waiting period. But for me, I reached out to all of these programs beforehand and actually got an interview before turning in my actual application through Forecast. So highly recommend that if anybody is in that situation. But during the interview, I experienced the same things, at least from what I heard from other people that I know that went through phase 1, in that I did a patient case presentation. I was given a patient case and I had to provide my assessment and my recommendation and answer any follow-up questions that the interviewers had. I had to answer questions with a panel of interviewers concerning different topics that they may ask me about, like recommendations that I made as a student, times that I experienced conflict, et cetera. As well as I did a presentation. So mine was on Hep C because I was doing a rotation in AmCare at that time, and my pharmacist was primarily a Hep C pharmacist. And so I had to do a presentation, and from there, got another interview. So I did 2 different interviews, and then just was asked more questions about what I've done and who I am, because programs are trying to get a better feel for who you are while you're trying to get a better feel for who they are and whether or not you'll fit into that culture. And yeah, the match day came and I found out that I matched with my first choice. So
Nice. That's really good. So I know when I went to a residency interview, I ended up doing my capstone. So your Hep C presentation, was that your capstone as well?
No. So I made my presentation like that night. So presentations are my thing. And because I already have the background knowledge on the topic and I've already been seeing patients within that rotation, I was able to tie the two together very nicely. I didn't use any previous presentations I had done. But also, I think that on my part showed to them what I'm able to produce in a short amount of time. And I also had technical difficulties during my interview as well, but not like I couldn't present on my end. I had to have the RPD put my PowerPoint up because I had animations in there and I just had to tell her when to click so that it can go. But that to them showed them how I'm able to work under pressure.
Oh, that's really good. That's really good. That's something that I know a lot of programs are looking for, because when you're in that residency program, you have to think very quickly on your feet and learn so much in a short period of time. So that was really good.
Yes.
So as you were in this residency program, you were able to touch on so many different fields of pharmacy within the hospital and all of that. Where do you see the ones that you like the most, or what do you feel like you're leaning towards after you finish this residency program?
Yeah, so far I've had a rotation in internal medicine, had a rotation in critical care, and I'm currently on my NICU women's health rotation. And in terms of where I'm leaning towards, I enjoy being well-rounded. I do not have a desire to go to one specific specialty. I hope to be at an institution that sees all ages if possible. But I really do love the NICU side of things. And I also love helping on the adult side of things. So I'm hoping to be at an institution that has both young and older patients. But at the same time, I'm very passionate about mentorship and just connecting with students. And so I want to go into academia. I just don't know if that's going to happen right after residency, because I've heard that it is very difficult to get that after doing a PGY1, being at an institution, as well as a pharmacy school teaching. But if that door opens up, I will definitely go that route. But I do know that academia, as well as having a hospital site where I'm able to precept and still make interventions for patients, is my ultimate desire.
Oh, nice. That's really good, being able to get into both of those areas at the same time, because I got a couple of friends that's doing that same thing, and they're really able to make an impact on the students' lives, because they're going to be able to see it from their view on both angles. Like, let me help you with your work so you can see how we actually think and see it on paper. And then let me help you clinically, because it's actually different by doing it than what's really on paper.
Yes, that is something that I'm constantly seeing. Like, there's stuff that I learned in the classroom that it's different here. Like, patients have something that's always going to be different than what the guidelines are necessarily lining out. And that clinical skill and thought process and thinking really does develop in the place of residency. But even more, you're able to, especially since I went through phase 2 and had that experience, I'm able to share the different things that I encountered with upcoming students so that they know how to navigate things better, and just understand, or are able to have somebody that's transparent. Because I think sometimes once you get this PharmD role, it's like, I'm the pharmacist, I know everything, and you need to learn from me. And I'm not a fan of when certain professors do that. And so I think it's good having somebody that you can just be transparent with and open with, like, hey, I went for this and this didn't necessarily happen. Oh, I went for this internship and I didn't get it. So I think it's also good for them to have somebody that's very relatable as well.
Definitely. Man, so you're in a residency program, and then you mentioned earlier in the interview that you like to do community outreach and things like that. And you have the ability, or you will be going on a mission trip in June to Nicaragua. Can you speak about that and how that makes you feel and how you're going to do and make an impact in those people's lives there?
Yes. So I actually went on my first mission trip in 2019 to the Dominican Republic. And I, along with the teams I was with, we were helping Haitians that were in the DR. And I was the only pharmacy student on the trip, and there was one pharmacist. And so I was in charge of checking out things on the formulary, setting up the pharmacy each day. At the time, my Spanish was better, and I was able to talk to the patients in Spanish and give their instructions. I was able to write the instructions for them on the bottle. And that really transforms just everything for me. I've done a lot of local things. When I was in pharmacy school, I would do health fairs at my church and I have a lot of friends that are in the healthcare profession. And so I had a pediatric nurse practitioner, nurses that were able to be a part of it, dietitian that were able to just come together, use our expertise and our skills to serve the community. And so I wanted to have that global experience. And so that was my first one. And I was supposed to go on a medical mission to Honduras last year, but then COVID happened and that got canceled. That was going to be my first rotation. So that was sad and very devastating. But fast forward to next year, I'll be able to be the pharmacist on the trip. So I'm going with the same group of individuals that I went with before, Global Health Outreach. And I'll actually be the pharmacist on the trip. So I was able to see on the other side, being a student and knowing how they do things with the formulary. So I'm really looking forward to going now as a pharmacist I'll be the one like in charge. Like I was a student helping then, but now I'm going to be able to, especially since I have that prior experience, be able to help whoever else comes along, because we have a lot of volunteers come too. And we have the opportunity to work closely with the interpreters. And as well, my goal is to be better at Spanish by the time I go. So I've been practicing each and every day to get to that level of speed that I was before, but even past that, so that I can have a closer connection with the individuals that I'm helping.
Nice. So at this point, do you know if you will have any pharmacy students that you will take in for this mission trip so that you will be able to guide them and teach them some things?
So I don't know yet. I could ask the doctor that's over the trip to see, but since there's still quite some time before the trip happens, I think that information is going to come out later. But I do hope that people do come on board. Typically, there's a lot of people that come on these trips. I mean, nurses, dentists, ophthalmologists, what's it called? Physicians, like physical therapists. I mean, there's so many people along as like students that come about. So I think there will probably be a pharmacy student on the trip given that experience.
All right. What's the name of this organization and how can someone reach out just in case a pharmacy student is looking at this and be like, you know what, I would love to go there and make an impact in Nicaragua?
Yeah, absolutely. So it's Global Health Outreach. That is the organization that puts on these mission trips. They are in conjunction with Christian Pharmacist Fellowship International, as well as Christian Medical and Dental Association, which I was members of, and they have scholarship money. So I would also recommend signing up so that you're able to get financial support to go on this trip. But if you type in GHO, you'll be able to see the different trips that they offer. They go on mission trips year round, and you can be able to have an impact with the individuals that you come in contact with that way. I also have a blog or a vlog on my YouTube channel showing or capturing my experience in 2019 that you can also check out. And I've linked information that you can click on so that you're able to go to the direct link. Because right now I'm saying GHO, but I don't know the direct link off my head. But if you Google it, you'll find it, or you can go to my YouTube, which would be RX Joy, and you'll find it there.
Nice. All right. So let's jump back onto the residency program and things like that. So do you have an example of how so far you was able to impact the patient's life that you have come across?
Yeah, a lot of examples. And in terms of one particular one, okay, so there, when a patient comes in, I'll use a critical care experience one. When a patient comes in, if they're coming into the ICU, then they are really sick, and they need interventions and therapy like as soon as possible. And so as a pharmacy resident working with, we also have medical residents. I would constantly like review cultures. So blood cultures, you don't get like or at least I wouldn't get like a notification of when a new blood culture was available for me to see. So I constantly like review their profiles to see, is the antibiotics that we're covering or using for them covering the organism that is growing on their cultures. And I had a patient who was on an antibiotic that wasn't covering what was growing on the culture, and they were spiking fevers. And so the attending had left for the day, but I was able to talk with the medical resident who is, because I can't just put in orders without having a physician that's able to agree with my recommendation and sign off on the order. And so in that instance, I was able to talk to the medical resident and get the patient on the appropriate antibiotic. I would recommend the name of the drug, the dosing, the frequency, the duration, and the patient is doing better and out of the ICU. So there are so many things that we can do on our end, especially because we know the drugs. We have the drug resources that we're able to reference to make sure that the medication of the patient is getting is appropriate, and we're looking out for the monitoring parameters as well. And so, yeah, that's just one of the examples. Another one I can think of as well is I had another patient who was on. I mean, I could talk for days, but I'll just share this. Yes, I'll share one more because. Like, it's just, it's amazing being on this side, especially the journey getting to here. So I'll just share really quickly. I had a patient on, specifically, they were on fluconazole because they had yeast in their blood, but they weren't getting better. Their white count was still going up. They were still spiking a fever. And fluconazole doesn't cover aspergillus. And I was able to recommend on the spot, can we switch them over to voriconazole, which covers that? And so they were able to get switched onto that. And so there's just so many ways in which we're able to impact patients, and I love it here.
That's good. I got a friend who's a pharmacist in the ED, and he's like, from his brain to the patient's veins. So like how he's able to help, like you just said, like, oh, you saw something, like, oh, they're not recovering or doing better on this medicine. So from your brain to their veins, you like, let's switch to this. You like, voila.
Yes. And it's really amazing. And I think pharmacists do not get the recognition that they deserve. Like, it's a lot of people when the word pharmacy comes up, automatically there's an association to community pharmacy, but on the hospital side, it's not really seeing the impact that we're able to make. Community pharmacists are making an impact, especially with COVID, like still not getting recognition there, but nobody ever thinks that, behind the hospital, there are also pharmacists there making an impact. So I'm very happy to be helping in this manner.
Definitely. I got a couple more questions. The next question, work-life balance. So how are you able to do mission trips, residency, training, and then also be able to kick back and like have some self-care time? What do you do?
Yes. So work-life balance is something I wish I had valued earlier on in life. I've always had a job since I was 16, but I remember just doing a lot of all-nighters frequently throughout my years, even in residency, trying to do all-nighters, not sleeping, just to get things done. And I found out that that is not healthy and it's not beneficial. If I don't sleep, I can't think. That is something that I have learned about myself, if not then, now. And so for me, I have to be disciplined with my time. And I say, okay, it's 10 o'clock, 10:30, I'm done. I'm not doing any more work. Whatever didn't get done, I would rather sleep now and wake up early to continue working on it than go to sleep late and still wake up early. So that's something that I put in place, is that I make sure that I'm not doing any work past 10:30, 11. Something else, I do use my PTO. That's something I recommend that everybody do. You do not work like a slave, even though residency can be seen that way. Please use your PTO. So I literally every single month I have left like Texas and gone back to Georgia or gone. I'm in a lot of weddings, so like I'll go to my friends' weddings. I make sure that I use my PTO and I don't just stay in the tiny city of Beaumont. I went to salsa night with some of the medical residents last Saturday. I make sure to incorporate time where I'm able to just relax because it's not beneficial to your mind to just continually work. Like you were made to rest in some regard. So use it. But it's still a process. It's still a work in process. I think as I go on in the years and as I get more responsibilities as an individual, I'll continually have to reassess my work-life balance. But right now I'm putting things in place to be very disciplined with that area.
Yeah, that's great. That's great. When you said it, it made me think of like a meme. We're like, I'm going to use my PTO. And it's like someone getting on the plane, like, listen, I want to take my time off.
Yeah.
I did my work. I'm doing everything I can, but I need me some me time. Like we all got to get into that mindset because if not, we're so dedicated to our jobs, being in our profession, that we would just keep working and working and working, that we have to like stop and be like, you know what? I need to work on me just as much as I need to work on my job. So that's really good.
Yes. And work will continue without you. Like, especially like my mindset is like, I'm the resident. I'm the only resident. They'll take care of it. Like they can still operate without you and maximizing. I was listening to this leadership podcast and it talks about maximizing your time on. So the hours in which I'm working hard to make sure I get all this work done. But when I'm off, that's my time to be off. So I really try not to do work on the weekends too. I'm like, where can I fit this in during my time on so I can make sure I'm able to use my time off to rest. So yeah, it's something we need to value more, especially as pharmacists.
Facts. That's really important too. Yeah, I try to do that all day, every day. I'm at work. Give me my list of things and I'm gonna just go through my list. And then whatever I don't get done today, I will bring this list in again tomorrow. And hopefully we find the free time to get it done the next day. But yeah.
Yeah, I agree.
So you talked about your blog, you talked about your social media. So I want to give you a chance to go ahead and let people know how they can get in contact with you. If they want to know a little bit about the residency programs, if they want to just know about mission programs, anything so that they can reach out, follow you on your YouTube, your Instagram, and other social media handles. So.
Yeah, so I'm a very transparent person. I love to share my pharmacy experience. So I have a blog called rxjoy.co where I talk about some of the things that I've experienced as a resident. I've experienced moving here to a new state for the first time. I have this thing called Feature Fridays, where I'll feature different clinicians and pharmacists that, and just healthcare providers that I've come in contact with that have made an impact on me, that can share their words of wisdom with you. So you can subscribe to my blog there. I also have my YouTube. I have not been active this year because it's been crazy transitioning into residency, but I do have some gems about like how to divide up your ARCS prep group book, as well as for those that have even gotten their feet wet in pharmacy. I have some videos there as well. So that's ARCS Joy for my YouTube. I'm on my Instagram. You can follow me at ARCS Joy _ or is it _ ARCS Joy? I'm off Instagram right now, so I don't know, but it's one of those. You can follow me there, and I have a direct link to my Instagram on my blog, so you can follow it there. Also, you can connect with me on LinkedIn. I'm pretty active there, sharing updates on what I've been doing professionally. So yeah, those are just a few of my handles you can follow me on and reach out if you have any questions, especially regarding the residency process. Now that forecast is open, I've had some people reach out to me. Feel free to come my way so I can help you, because I'm all about, like, there's not competition. Like, we're all trying to get to a destination in any way that can be of any help. I'm happy to be here.
Nice. Well, Dr. Joy Nwoke, I appreciate you coming on Pill Talk Podcast, sharing your knowledge, dropping those daily doses to inspire, motivate, and live at your full potential. I appreciate you. Hopefully I can jump on one of your featured Fridays soon and be on there. But thank you again.
Yes, thank you. Appreciate it.